Hi, I'm Erin Power.
And I'm Laura Rupsis.
We're certified health coaches, and this is Health Coach Radio.
This podcast is about the art, science, and business of health coaching.
We share our insider tips to help you become a better coach and entrepreneur.
And we interview expert guests to discover how they've made it in this growing field.
It's time for health coaches to make an impact.
It's time for Health Coach Radio.
All right, we've got Adrien in the house. How are you, Adrien?
I'm very pleased. I'm so excited to meet with y'all and chat with y'all. It's going to be fun.
I guess we like to start every conversation with, who are you? You know, what brings you here? Who are you? But most importantly, kind of how you got here. I think as health coaches that moving into this space, hearing other people's origin stories really helps them relate.
Yeah. Well, full disclosure, I'm not a health coach, but I adore health coaches. So I'm just so excited to dive more into the space, get to know more health coaches, but also to build up this profession as much as possible. So long story short, I'm a registered dietitian and have been in private practice, 17 years now. Started just as a solopreneur, built into a group practice, and recently partnered with a technology company. So we're able to go national. And so as an entrepreneur, I've seen it all. I have made every mistake known to man. And I'm sure there's more that I will make. But I think that's also a big passion for me, is to teach other providers about how to be a business owner, because we know how to help people. We got that. That is what you went to school for. That's what's in your little passion heart. But how do you make some money and be successful?
Yeah.
So that's
wow.
me.
Wow. Bravo. Shortest origin story ever. That was great. And I, when you were telling that story, I took like 8 notes that I need to follow up on. So here we go.
Okay.
First of all, one thing that you shared that I thought was really insightful, and I want to just highlight it, is you said, you know, you've been an entrepreneur, you've been in private practice for 17 years. You've made every mistake. But what I hear is that you've learned by trying. That was all part of practicing. And anytime we're practicing something new, we're probably going to screw up and it's going to feel hard. So you went through that. I know it's been a long journey for you, but when you reflect back on these mistakes that you made, how do you generally feel about them?
After, because it's been some years and you can oh, okay, that doesn't hurt as much. The wounds are gone, but you still got the battle scars. It's one of those, I'm so glad I did it. I am so glad I tried. I am so glad I didn't get stuck in perfectionist paralysis. I'm so glad I just was naive enough to try.
Oh, yes. Okay. That's like coaches, any health entrepreneur listening, that is a pep talk from you in the future. That is future you talking to current you. Current you is in it and maybe not loving every minute of it. But I think anybody who's come through and has a successful practice will say the same thing. You know what? I'm so glad I did it. It was so worth it. When I look back on it now, it was kind of fun, kind of interesting that I did that. So I really appreciate that pep talk.
I mean, there's times that all honesty, there are many times I'm like, I'm closing, I'm done.
I know.
I'm table flipping, I'm out of here. And then you go and have a glass of wine and talk it out. And then you're like, okay, I can do this. I can do this.
Yeah. A good night's sleep.
Yes.
So many of us come to this profession for a reason. There was something about this that drew us. Do you mind sharing a little bit about what drew you here towards dietetics and nutrition?
I wasn't as a good dancer as I thought I was. So I thought I was going to be a ballerina, and had one of those come to Jesus moments of oh, I'm good. I'm not that good. And I don't want to be a backup dancer. My mom is a nurse, and I was like, oh, I like helping people. I just don't want to touch them. And so I was like, I like food. Food's cool. And that's about as much research as I did. And once I kind of delved more into it, I love science. I love biochemistry. And I fell into eating disorders. That's kind of my background and my kind of expert area. And it sounds so weird to say, but I love eating disorders. It's just one of my passions and so fascinating.
Oh, interesting.
Yeah.
Okay. So, because when you went into private practice, because I mean, I don't feel like I know many RDs in private practice.
No.
Yeah. So I'm curious about that because it doesn't seem like the popular career path for the dietetics realm.
No, not at all.
Yeah. So is your private practice, did it start as eating disorder stuff?
Yeah, so it started as eating disorders. I worked at a treatment center locally, and they're like, "Oh, well, everybody after they go through treatment has to see an outpatient registered dietitian, along with other people in their care team." And they were like, "Oh, do you know anybody?" Like, well, like I guess I'll raise my hand. But like super secret weapon. My dad's also an entrepreneur, so I was like, "Oh, well, he does this. It doesn't look hard from the outside as a child." So I kind of was like, "Well, this makes sense." Bum 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 bum.
Yeah. It's to your point, Erin, especially then, like 17 years ago, it was not as common. We're hearing it more and more today. Dietitians realizing how much more money they can make on their own compared to going out and getting a job, but also the freedom in terms of how you choose to practice within reason. I mean, you're still a licensed practitioner, even if you're working independently, but you've got a lot more latitude in terms of approaches compared to, working in a hospital or some other clinical setting. So we're seeing that pick up more now. Now you said you started as a solopreneur, but then partnered with a technology company. I feel like you kind of skipped a lot.
There was a couple of years, yeah.
Yeah, I gotta imagine there's a couple steps. So first of all, I would love to hear what that process of becoming a solopreneur was like for you, and that what was it that sparked that whether I want more or I can do more, and why technology? Fill us in.
Yeah. So started as a solopreneur because there was a need in the area to see outpatient eating disorders. And for me, there was 17 years ago, there was no business coaches, there was no Instagram. Instagram wasn't around that long ago. Oh my God, I'm dating myself. And so it was a lot of books, and I called up a lot of other providers in my area and just said, "Hey, are you open to like chatting? I want to learn. How did you do this? What do I need to do?" So I wasn't scared to call people and ask for help. But one of the things that was really part of my value system was to accept health insurance, because I thought that that was something that if people really struggled with valuing their health, how are they actually going to pay for it? And so in the eating disorder world, that was something that was, oh, they don't really want to see me. So how can I make this cost effective? And so that's kind of what snowballed for me, was being a health insurance provider and really figuring that out. And it was not pretty. I made a lot of mistakes. I think I got reimbursed $2 for a visit one day.
Wow.
Yeah. So I learned a lot. But over the years, because I was in network with a lot of health insurance companies, I would get calls from random corporations. And like, "Oh, we see that you're on our insurance. Can we send over 60 new patients?" I'm like, "Yes." "Oh, crap. Okay. Yeah." So it was just one of those things that, because I was willing to do some really hard administrative work, it paid off in the long run. And to jump into the technology space, I will answer any email anybody ever sends me that's wanting to learn more. And I'm like, "Oh, cool. Yeah. You want to learn about nutrition?" Yes, I will answer it. And so I answered a random email from people that were wanting to get into the nutrition space, and had wonderful conversations. And they're like, "Well, have you ever thought about partnering?" And I was like, "No." Okay. And it's been a year, and it's been absolutely mind blowing to jump in like a technology side of how to bring nutrition to the masses.
Okay. Well, we definitely want to understand that technology. But like, there's so many things that I pick up when you're talking. So first of all, it's like you're open to everything. You're like, sure, I'll figure out how to do it. Sure, I'll partner, which is really cool. That's just a really that's a growth mindset probably embodied. Um, I think that the insurance provider piece is interesting because you really zoomed out and thought of it from the perspective of the customer experience. Like, what is going to bring this particular clientele who are so sensitive about food and diet and wellness? what can I do to remove friction from their experience?
Mhm.
I just honestly, this is an exercise every entrepreneur, every health entrepreneur should go through. And I think a good place to start is just in understanding what you as a consumer would find frictiony or not, or smooth, in a customer experience. So I think that's really important that you did that. So I think your dad's entrepreneurial genes rubbed off on you for sure.
I hope so.
One thing that I do think is really interesting is that, when you're telling about your story and your niche, so your niche being eating disorder patients, and this is a very sensitive topic, so we just want people to take care of themselves as they're listening. But if you love it, like, can you talk about how and why you love it so much?
Oh, because I think it's that relationship with food.
Mm.
How I explain it is somehow food became good, bad, right, wrong, and it
Mhm.
got stuck to emotions. And it's this kind of roller coaster ride. And so, as the dietitian on the care team, my job is to really help somebody understand the nutrition side. Well, what do you actually need in your body from a biochemical place? Like, why do you need carbohydrates? What's the purpose of them? What do you need fat? What do you need protein for? And who you are in this world and the good, bad, right, wrong, that's for your therapist, for your psychiatrist. I don't know how to fix that piece, and nor do I want to. And so where I love it is it's a really long journey for somebody. And for me, it's I'm able to see somebody really develop a new relationship with food, their body. So I've loved it.
That is cool. That is very cool. It's sort of like by focusing them in on the biochemistry of nutrition, you could almost cleave apart the character assessment piece that, for whatever reason, culturally has been
Mhm.
Oh
stuck to
yeah.
that. Yeah,
Yeah, 100%.
nice.
So do you have a specific, so tell us, like, as a dietitian, how are you tackling eating disorder? Because I have to imagine, so look, this is, again, for health coaches, a sensitive topic because you're not a dietitian. And maybe that's a good thing. Maybe providing meal plans and a diet to someone who's got an eating disorder is probably not the best plan. But also, we're not psychiatrists and therapists either. Like, that's a whole other kettle of fish. But we can let the client just express how they're feeling and provide education and ask questions and help that client, like accompany that client down the path of rediscovering food for themselves.
Mhm.
Oh,
Right.
100%.
So in terms of, like, in my mind, I could imagine what that conversation might be as a health coach. Is it different or similar as a dietitian? So how do you?
Yeah. So I would say it's a little bit parallel in the sense that, yes, we want to help them along that journey. We don't go too deep into the why or tools of, like, when you are having the emotional reactions and you reach for food, like, how do you do some uh, therapeutic techniques? Like, we don't go into all the therapeutic techniques, but we do kind of look at when somebody is coming in a malnourished state, maybe overnourished, undernourished, really looking at, well, what does this body need to be nourished? What's going on with their brain chemistry, the serotonin, dopamine, so that they are more regulated. But they also might be really afraid of food. So how do we start to bring peace into food? And so they might be needing to have some more carbohydrates. I might be like, oh, let's have a loaf of bread, because they might run from the other direction because they are terrified of bread, or they've never had bread in 8 years. So it's more of a gentle approach of, like, let's try, maybe I'm just making up things, quinoa for this week, and see how it goes. So
Mhm.
where I see health coaches plugging in that is that in between state is, well, how did it go? What kind of tools, and having those in-depth conversations around that.
Yes.
Yeah.
Yeah, that's sort of like running experiments and collecting the data is
Mhm.
really, really in a health coach's wheelhouse. Hey, it's Erin, co-host of Health Coach Radio. I've trained men and women of all different body types and skill levels, and take it from me, women are made for strength. They may just have a different way of getting there than men do. With the Primal Health Coach Institute's Strength Training for Women Specialist certification, you'll be able to address the needs, challenges, questions, and goals most relevant to women. You'll learn how to design a training program, and then you'll develop one. You'll also learn how to co-create individual eating strategies for clients and how to navigate potentially sensitive topics like menopause, reproductive cycles, hormone-related dysfunction, and diet culture. If you want to empower women to become fitter and stronger, then visit primalhealthcoach.com and learn more about our specialization in strength training for women. Boy, I'm just thinking through this because when we teach health coaches to find their niche that makes them as excited as yours does, the kind of exercise we take them through, and I think probably most business teachers would, is to say, well, who are you and where did you come from? And so I'm just putting this out there. I'm just flagging this because if somebody out there's listening and they had an eating disorder and they think, I'm a health coach that had an eating disorder and I have recovered from it, I want to get into the eating disorder space. That's a little bit of a slippery slope. I just, as somebody who did recover from eating disorder, I don't actually touch them. I don't actually touch disordered eating people. I try to advocate with them with actual healthcare professionals, but I won't take them on. So I just want to maybe caution health coaches that are thinking that eating disorder sounds like a niche they can relate to because they suffered with one themselves. It's just that's a little dicey on the scope of practice for us.
Yeah. And I would say the same. And I think it goes for a lot of people. We want to help those that we've also gone through. And in our practice, we always say, you got to do your own work. And it's always you got to check yourself before you wreck yourself. And having somebody to check in with of like, oh, this is really triggering. Maybe I don't need to. Or sometimes you can really get down into that same level of the patient. And I'm like, oh, I get it. So it just, I tell people like, you not got to know you.
This speaks actually to the collaborative piece, which is, the health coach can help with these experiments, behavior change stuff, connecting to intrinsic motivators, behavior change, all that great stuff that we're really good at. And we can and should save the clinical stuff for the clinical practitioners. And there's room and necessity for both.
Yes. And I love that health coaches do the behavior change. I was talking to one of our dietitians this morning and she's like, oh my gosh, I think I've been seeing this patient for like a year and they're still in pre-contemplation. What do I do? I'm like, I don't know. You've been doing everything right. I don't know. Let's see, who else can we get on the team? And so I think that's one of the areas that we can definitely have that collaborative approach.
100%.
It's so interesting you brought that in, that trans theoretical model piece, because that's just wild to me, because a patient who's been directed to your clinic might not be ready for help.
Oh gosh, no. Yeah.
And typically in private practice health coaching, we don't see that as much. People seek out a health coach when they're ready for help.
Oh.
Nobody's put into health coaching. So that's a really different paradigm.
I would say it's a good 50-50 mix of people that are sent to us and those that are choosing to see us. So a lot of times a doctor will refer, oh, you're newly diagnosed diabetic. You got to go see a dietitian. And they're like, well, I don't want to. I'm like, but you got to. And so they are not even anywhere on that behavioral model. Like, nope, still not even thinking it. So it will take years sometimes for somebody to get to pre-contemplation or contemplation.
Yes.
It's funny because this is to Erin's point, health coaches, for those of us, because similar to dietetics, well, actually it's like the opposite. It's opposite of dietetics, whereas 10 years ago, 15 years ago, there was no job to work clinically as a health coach. Not really. The vast majority of people that moved into that realm were self-employed and had private practice. And now it's coming to the point where there's a ton of jobs now, right? And they are being offered by insurance providers, hospital systems, larger scale sort of metabolic illness type companies, health food stores, supplement companies, gyms, like you name it. There's a lot of sort of employment opportunities. So now health coaches are kind of entering into this realm. Before, where we would, I think, butt up against that was when health coaches were kind of still in the mode of feeling as though they had to convince people to work with them, right? That they had to have this hard sales pitch to bring someone on board, or they're trying to convince a friend or family member. But it really wasn't this person is being forced to come see me. And we're starting to see that again, if they're working on a care team, like a collaborative, and being able to kind of understand all that. But we were talking before we hit recording, the concept of collaborating, and that, we really, if we do this right and we view our roles as distinct and important, we really can fit tongue and groove with each other. dietitians and health coaches, dietitians and doctors and health coaches, and so on. So it sounds to me like you might be dabbling in this collaborative piece with health coaches. I mean, would you tell me a little bit about kind of your experience on working with health coaches in a collaborative way?
Yeah. I've always thought that it takes a village to help a patient. And so having a care team, because everybody will say things differently, the patient will hear things differently. And so we all might be saying the same thing, but what the patient picks up on in that moment, what they're ready for is so different. And so what I've seen really well is having a therapist, a health coach, and a dietitian, and it's been awesome. There's a lot of different insurance providers right now that are like adding that in as part of like a care team, and it's great because in eating disorder land, sometimes that eating disorder will tell one provider one thing, one provider another thing. And so having a care team will be like, well, when I was talking to your health coach, they actually said this and this and this. And so we're able to really help that eating disorder not bamboozle another provider and really help that patient to make better choices, to really separate them from that eating disorder and give them the tools and the initiative in themselves to want to do better and change.
That's a really nice model. Those three providers. That's really cool.
Yeah.
So like, what's the interval generally? Maybe it varies from person to person, but how often do you meet with a client? Does the therapist meet with the client? Does the health coach meet with the client generally?
And in eating disorder land, and we can look at other issues as well. We like to see the patient weekly in the very beginning, just because I want to get to know them. I want to get to know what's going on. And same with the therapist and the health coach. So it's a big commitment for a patient. And so financial commitment, time commitment. And so that's where it can be hard to get somebody to buy in. And we also want to be super flexible and reasonable. Like, cool. If it needs to be every other week, cool. We want to make sure you're seeing a professional weekly, because there's so much that has to change in the beginning. And you also have to get comfortable in this conversation and having these new ways of thinking about things. So that's our recommendation in eating disorder land. What we've seen in like diabetes and heart disease, it's because people aren't used to the therapy world and aren't used to meeting with a provider weekly. It is so off-putting when somebody who's like newly diagnosed, they're like, oh, I have to see you weekly. We're like, yeah, it's amazing. And they're like, yeah, no, this isn't going to work. So we like to ease into how about you meet with a health coach one week? How about you meet with a dietitian? And so we slowly kind of ease them in. And shockingly enough, we was actually talking to a physician that we partner with, and they're like, oh yeah, this patient is not compliant with their meds, but man, they see y'all weekly. And we're like, sorry, something's working, I guess.
Yeah, very cool. So now your services and the therapist services would be covered through insurance.
Yes.
The health coaches wouldn't be.
And you guys would know better than I would.
Yeah.
I was on a call probably 2-3 months ago that there is some CPT codes coming out for health coaches, hopefully soon. And so I think hopefully maybe before the end of the year that health coaches would be covered by health insurance, but you guys would know way better than I would.
Yeah. So, I mean, at last update, it was there are CPT codes, but they're category 3. They're not reimbursable. They're sort of trackable. And that the hope, this was what, 2 years ago, Erin, when we were speaking to the people at the national board, they were thinking it was probably a 3-year at least kind of process. So we might be getting closer. So here's, when it comes to accepting insurance, for folks that are working within it makes complete sense, right? That this is kind of all wrapped up in sort of the care team model. For those that are working independently, one of the things we had heard is that unless the health coach is also a licensed practitioner or working in a location where they have access to insurance billing, it's likely going to be even longer for an independent, just private practice health coach to bill insurance. And then the next question, and here's to tap on something you said earlier, do you want to?
Yeah.
In terms of your own ability to actually, I mean, I hear this from doctors in terms of, what they're like, what they actually take home after they bill insurance, when insurance is actually willing to pay for their time and their expertise. I don't know if you have any thoughts there, because you're right. There's this double-edged sword of everyone should be able to afford this kind of care. They should have access to it in some capacity. And for some, from a financial point of view, if insurance doesn't cover it, they just can't afford it.
Mm-hmm.
Right. But then there's this other notion of, but if somebody else is paying the bill, how invested is my client really? So, I mean, what's your experience been in terms of accepting insurance? And is there a best practices as it relates to?
Yeah. I think it varies from human to human. And I think it goes back to, are they ready to make changes? And so those that aren't ready to make changes, it doesn't matter who's paying for it. And so I think it kind of goes back to readiness to change. I have patients that there's absolutely no way they would ever be able to afford to see a dietitian. And they're the most consistent. I think we've had them in our practice for 12 years now, and they've never missed a session. If they have to, they email, they call, they are like the most diligent. And so I think it just comes back to the person and where they are on change model. But as far as what you get reimbursed, it's not what we take home from private pay. And it's also, if you are able to, we are able to see patients longer. We're able to see them weekly versus every 3 months. So maybe I don't get the same reimbursement, but I get to see them more often. So quantity over like that one and done, because sometimes I can only tell you so much and it's not sticking. So I think it's, again, looking at your business model, looking at your demographical patient, and then looking at what do you want to make and how much do you want to work? So it's a lot of, as an entrepreneur, back end math.
Yeah.
Yeah.
There's a lot at play. I mean, your potential for income is really important. It's something that people think about and plan for, and in some cases worry about. And then also there's the impact piece. So where can I have the most impact? I think that the anecdote you shared of the client patient in your case that maybe didn't have the deepest pockets, but was the most ready for change, was the most engaged. That's huge. We can get a little transactional sometimes, and understandably, when we're starting a private practice, it can be a bit of a transactional journey where I need X number of clients to pay me X number of dollars this many times over and over. But doing work with clients and patients that want to change is rewarding in a way that you almost can't put a price tag on.
It just fills up that little like provider heart. You're like, oh, this is why I do it. And so it's good to have a mix.
Yes. Cool.
Yeah. It just, I think it allows you to solve a problem for multiple types of people and kind of demographics. And so, I personally am grateful for the national board and that they've put our profession on this path. In terms of being part of the conversation and finally being this credible, acceptable member of a healthcare team, where in the past, folks that either didn't really understand health coaching kind of poo-pooed it, right? What do you know? You don't have a PhD or a master's or whatever. But there was also a lot of folks who were putting themselves out as health coaches that weren't health coaches. They were doing something else, but they were sort of co-opting the term. And then by that nature, sort of, I don't know, handicapping the profession to a certain degree, right? So this gave us an opportunity to bring that back. No, this is what we do. And folks that are health coaches, this is what we do. She might call herself a health coach, or he might call himself a health coach. Not really a health coach. Okay. So the national board has really done a phenomenal job of putting some parentheses around this. So I love that. And they've opened up so many opportunities for health coaches that want to work in the clinical space. And I speak to a lot of people in my role at our school that are coming from the clinical realm, that are looking to pivot to more of a coaching collaborative model. Tons and tons of nurses, tons and tons of them, physician's assistants, doctors, more and more people moving from, a conventional model to more of like a concierge integrative model. We're seeing it. And the big missing link for a lot of these practitioners is who's going to fill in the gap. I can't be there to answer questions every week. And so this is where we're coming in, and it's working beautifully for those that are doing it. And so this collaborative model has become a growing path, a growing professional path. Do you have some thoughts in terms of what a potential collaborative partner might be looking for in a health coach, and how to make yourself, I guess, an attractive partner to somebody that's looking to kind of fill that gap? Do you have any thoughts there?
Yeah, I would say one that is open to collaboration. So many people have that scarcity mindset, like,
Mhm.
well, I can't work with you. I can't because you're just going to steal that patient. And so, which is just mind blowing to me. There's more than enough people, with more than enough issues that we can all. There's more than enough that we can do to help support each other. So I'd say one, having that collaborative mindset. Two, being like, what is your collaborative approach to care? And so having that really laid out before you jump into it. And so what kind of our philosophy is that we want to make sure that we are talking to you every single week, and that we are having our clinical notes sent over to you every single week, so that you're in the loop, you're part of this conversation, that you're not left out. So
Mhm.
that's one of our clinical standards. And so I think having that as a presence, and like, this is what we stand for, this is what we believe in. Don't be apologetic for wanting to talk to people. And I think that will really set you apart from so many other providers. And it will make people want to refer to you. There's so many times where physicians are like, you want to talk to us? You send us your notes. And so I think that a collaborative approach is starting to change in what healthcare looks like.
Oh man, that would
Mhm.
be amazing. That'd be amazing. I like, we see it too. We kind of feel like we see that too. We're training health coaches to function in a conventional healthcare setting. So we have a course where we say, okay, this is coming online. This is becoming very real. You have to kind of get in there and sort of, in manner of speaking, behave the way the conventional medical system behaves, and we're going to teach you how to do that. And it's just really exciting to have gone through the research in creating this curriculum and realizing that, yeah, it is shifting that way. It really is.
It's
It's so,
awesome.
it is. It's awesome. It's awesome for, honestly, sick people. It's so
Yeah,
awesome for sick
right.
people. Um, I've never been a sick person, but we all know people who have been sort of trapped in this sort of unproductive medical system, unfortunately, and even doctors feel stymied by it and practitioners feel stymied by it. And I feel like we're finally kind of getting out of that little crazy cyclone.
Oh,
Maybe.
yeah, and 2 brains are better than 1, because when you're able to collaborate, you're like, "Oh, well, they said that when they do the X, Y, and Z, this happens. Oh, well, what if we did it this way and this way?" Like, "Oh, that makes so much sense." So you're able to have 2 brains, maybe 3, maybe 4 brains working on one patient's issue. "Oh, we're gonna fix that lickety split."
Yeah.
Yeah, I love it. So tell us, so you received an email from someone from a technology company, random. Hey, or do you ever collaborate? To which you were like,
Sure.
I thought about it. Yeah. So tell me where, you have this solo practice, and where this sort of technology piece fits. Has it just sort of enhanced what you're doing and allowed you to grow, or is this like an entirely separate track? Is it a complete pivot? I want to hear more about kind of what you mean by I have this technology. What kind of
Yeah.
technology is it?
Yeah. So they partnered with us. So we had 12 providers, and they were able to help with the financial side. And so we were able to go from 12 to 55 in a
Wow.
year, and really take over and build our own technology of like scheduling and EMRs. And from that, we're hoping this next year to build technology in the sense that, in between sessions is when all the magic happens. And so, what if you got some education? What if you got a different way of tracking nutrition? What if you got a different way, like lab work, or your groceries delivered to you? So, how can we take all these existing technologies and put them into one platform that is focused on nutritional care? And so, that's kind of what we're in the process of building. And so it was by partnering with this technology company, we were able to take a 12-person team and explode it. And now we get to build fun technology on it.
Ooh, that's cool.
Yeah.
That's like kind of a neat brainstorming, like anything goes. If you were going to
Yeah.
make a software application that solved, like removed all the barriers to healthy living,
Mhm.
you know, you'd have your step tracker, you'd have your grocery delivery, you could have maybe your sleep app and all your lab tests, like really cool. I think it's neat to be able to just sort of blue sky like that and imagine what would be an incredible client patient solution from their perspective.
Mhm. Yeah. So that's the dream. So knock on wood, we're building it one step at a time.
So this is all proprietary stuff then. You didn't just pick a technology and white label it.
No, no. After this recording, I'm actually going into meetings of like, okay, so what are we building for this? And we're kind of trying to do it by diagnosing, not just like general humans. And so actually going into meetings after this and be like, what goes next? What's the next step? And so, yeah, we're really excited, and we're also really focused on outcomes. So what does it mean to have success? What does it mean to have these kind of different outcomes? And we're trying really hard not to use weight as a determinant of health.
Wow. Dang. Is that because of the eating disorder population that you,
Yeah.
yeah. But you focus on you have other
Yep.
types of patients too. So it's like the experience then, I always try to think about this stuff, like the journey of the technology is like the doctor plugs in the diagnosis and then maybe the treatment plan or the diagnosis. And then that
Mhm.
kind of, would that kick this person into some kind of like funnel where they're
Yeah.
directed appropriately?
Yeah. So if they were, the doctor's like, okay, this person's newly diagnosed diabetic. Okay, they kick them into our diabetic funnel. Okay, what does that look like? What are the educations that they really need to have? What is the support? What is the behavior change? What is the community? What is all of the puzzle pieces that this person needs to have success to control their diabetes or maybe get off some of the medication?
Ooh.
Yeah. So is this technology part kind of patient CRM-ish kind of? Plus, is there like a client, like a patient portal where they access education and you guys have the ability to communicate
Yep.
and all of
So,
that?
yeah, we're building an app this year. And of course, it'll be a HIPAA compliant app where they'll be able to talk to their care team. They'll be able to talk to their dietitian. And they'll be getting sent messages and reminders. So like, oh, don't forget, you need to be drinking so much water. Oh, don't forget to
Mhm.
check your blood sugar. And also hopefully helping them along with what you guys do so well with behavior change, because that is the hardest thing. It doesn't matter what the diagnosis is. It's all about the behavior change.
Yeah. I think it's so interesting because, okay, I'm going to pull out a really strange anecdote, but I've been thinking about this on my walks where I do my best thinking. So there's tons of apps. There are so many apps. Health coaches we've heard from them on this podcast. We've personally, as educators, vetted most of them, these client management, practice management systems. So kind of what you're describing is there's some of that. There's like a learning management. So like a curriculum piece and there's a communication piece and there's all this stuff. Okay. I downloaded an app recently to help me take care of my plants because I'm not good at plants. I'm just not good at taking care of plants. And so every individual plant that I own, I have to plug it into the app and it tells me all the characteristics of this plant. It needs this much light. It even tells me where in my house I should put it based on the light meter. So the app has a light meter. It says, no, don't put that plant there. It's too dark. Put it over there. Like this app is literally micromanaging my plant experience. But the thing is, my experience as the user is when I open the app, it's got little, very pleasing to the eye little buttons that I have to touch. Today's tasks: mist this plant, water this plant, fertilize this plant. And I have to just touch them when I'm done, and I'm done. And I get so much joy out of the simplicity of checking off those little bubbles, those little, hitting those little bubbles and checking them off every day. And like I feel like that whenever I look at a practice management system, the user experience is never that sweet.
Mhm.
I think that we can learn a lot from this plant now, to be honest with you.
I love it. Oh,
Yeah.
yeah. User experience is, oh, I've learned a lot in the technology world in the last
Yeah.
year, but that's a whole like job description is user experience for engineers. And I was like, I had no idea that that's why I loved an app so much or this website so much. And so, yeah, and that's a huge piece because people have to love the app in order to
Yes.
use it.
Right. Right. And so like, it feels like this technology is going to be such an awesome shortcut. It's just going to be so great, removing all the friction, but our leverage point for friction has just changed.
Yes.
So like if I open the app and I have to navigate through a menu to figure out how to get in touch with my dietitian or health coach, it's like, I'm not going to. That's already too many steps. Like there has to be clear. What do I have to do today? What is my learning objective for today? What is my task? How can I get in touch? Like simple little touch points. There's a lot to think about with that. I mean, my hat goes off to you because you're in a whole nother realm now, and I think that's your growth mindset, willing to learn technology.
Yeah. And have lots of wonderful engineers on the team that I get to learn from as well.
Yes.
So how did you grow from 12 to 55? So you had 12 people. This technology gave you, it sounds to me like the bandwidth to bring on more kind of moving parts and kind of keep it organized and flowing properly. I mean, I have to imagine, is your business like entirely online and remote now? And that's how you see people, like they don't have to come to the office and all that. How did you find your other practitioners? Did you post a job ad? Did people just reach out to you? Oh, she reads her emails. I'm going to send her an email and find out if there's a job. How does that work?
So there's a lot of questions there. So when when we partnered with a tech firm, it was wonderful because I got to step down as CEO and really take over the clinical side. And that's what gave me the bandwidth to hire, to vet, to really develop training. I didn't have to worry about payroll and HR and hiring technology people. I could really focus on clinical quality of care and people. And so that was wonderful. As owning a practice for so many years, sometimes not being the CEO is lovely. And so from that, it was really great. We, knock on wood, we've never had to put out an ad for providers. Facebook groups people are a part of, and they'll say, oh, I saw this ad for working at Nourish and da-da-da. And we have a really rigorous interview process because we only want people that have experience or are really in the same kind of mindset. And so I think to date, we have over 400 people applying. It's been wonderful. It's just, so we're doing something right. I don't know what it all is, but we've been able to really not have to stress too much about finding really great providers. They seem to find us.
Awesome. Wow. That's a testament to all the work you've done. And,
I hope so.
Yeah. And it's what I find interesting about that story too, is how you've been able to come full circle. In order to be able to do what you wanted to do, you felt the need to start your own business. And with that came all this other stuff you really didn't like doing, but you did it. And now being able to kind of think through next level and what you do and be able to offload that sort of role as CEO for you to focus on what you really love again and be able to have the career you love. So I love that.
And I think even in the beginning, when I was first like going from solopreneur to group practice, was okay, I can't do all of the things by myself, nor do I want to. So hiring was something I wish I would have done sooner, of like hiring an administrative assistant, hiring a VA, hiring help and support, for hiring somebody to market. Oh, geez. Yeah. I think those are all the things that as an entrepreneur, where to start.
Yeah. That's interesting. That's an interesting sort of posthumous bit of advice. Like I wish I had outsourced these things sooner. But no regrets. No regrets.
No regrets.
Very cool. It sounds like you have such a cool business built and growing and thriving, and man, you're on to like the next chapter with this technology piece. If folks wanted to follow along and learn more about what you're doing, where could they track you down?
Yeah, just use nourish.com as our website on all the socials. And me personally is just Adrien Paczosa. And yeah, we try to keep it simple. We're not too flashy.
Amazing. You're doing great stuff.
It.
It's really cool to hear. Really cool to hear the collaborative approach. Very cool to have talked to somebody who grew a private practice that grew and grew and grew and kept growing. Really wonderful. Really appreciate it, Adrien.
Thank you. Yeah, anything's possible.
Yeah. I mean, so if health coaches are going to take anything away from this conversation and how what you've done, what they can learn from that, kind of what are your parting thoughts there in terms of what health coaches can kind of take away from this conversation?
I would say get to know other providers. That was the best advice somebody ever told me, is get to know every other provider in your area. If that's your specialty area, if that's geographical area, have coffee, have a Zoom call, get to know other people, because finding people that will want to collaborate with you is honestly what grew my business leaps and bounds.
Very good.
Hopefully health coaches listening walk away with a little bit of confidence to just say, hey, this is what I do, and you're open to collaboration. Just leave it open. See what they have in mind. So I love that. Thank you so much.
Thank y'all.
This podcast was brought to you by Primal Health Coach Institute. To learn more about how to become a successful health coach, get in touch with us by visiting primalhealthcoach.com/call. Or if you're already a successful health coach, practitioner, influencer, or thought leader with a thriving business and an interesting story, we'd love to hear from you. Connect with us at hello@primalhealthcoach.com and let us know why we need to interview you for Health Coach Radio. Thanks for listening.